Cause of death. Natural causes: anoxia, intrapartum or antepartum, cerebral birth trauma, congenital disease, plague, syphilis, disease of the child affecting vital organs, erythroblastosis, hemorrhage from umbilical cord, genital organs, stomach, rectum. Immaturity, post-maturity, lack of general development, malformation, neonatal infection, placenta disease, placenta previa, accident separation, pre-eclamptic toxemia, unnatural. During birth, accidental during birth, prolonged labor, intracranial hemorrhage with or without fissured fracture of the parietal bone, caused by severe compression of the head against the contracture of deformed pelvis, extradural hematoma rare, subdural hematoma common, usually bilateral, may be above or below tentorium depending on the site of the injury, caused by tearing of bridge vein, example greater cerebral vein, or less commonly from tears of the falx cerebrae or falx cerebellae. Associated findings: infant head shows molding and caput succedaneum, fracture and dislocation of clavicle and limb bone. Prolapse or pressure on cord. Mechanism: cord compressed by fetal head, especially in breech position presentation. Death by asphyxia. Postmortem examination: blood, liquor, amniotic, meconium and vernix caseosa found in bronchial tubes. Intrauterine or intravaginal strangulation: cord may twist around the fetal neck or knot may form a death by stoppage of blood supply to head, but not by asphyxia. As fetus does not respire within womb or birth canal, the possibility of deliberate strangulation with the umbilical cord after birth must be kept in mind. Differences: in accidental strangulation, cervical tissue injury is at a higher level. Wharton's jelly is not damaged. Lung unexpanded or only partially expanded. Postmortem examination: sign of compression on neck, but no abrasion or echinosis. Injuries to the mother: trauma, heavy blows, kicks, fall from delivery table, etc. Concussion of brain in children may or may not be associated with fracture, skull, rupture of blood vessels or internal organs. Powerful uterine contraction may rarely fracture cranial bones of the fetus. Death of the mother causes death of the child as she does not get a blood supply, may be delivered within 5 to 10 minutes of mother's death. After birth, asphyxia causes smothering, membrane over the head during birth, face is pressed accidentally in clothes, drowning, submerged in discharges, blood, liquor, amniotic, meconium. Survival: a child can survive in the membrane for 20 to 30 minutes. Precipitate labor. Precipitate labor is the expulsion of fetus within less than 3 hours of commencement of contraction. Silent fishes: all the 3 stages of labor are merged in one. Delivery occurs suddenly and rapidly, even without the knowledge of the mother. Delivery may occur even unconsciously during anesthesia, apoplexy, asphyxia, coma, deep drunkenness, delirium, eclamptic convulsion, fits, hypnosis, hysteria, influence of narcotic or intoxicating drugs, sleep, syncope. Such conditions are thought to bring out a deep lethargy and complete loss of sensation, preventing the mother to sense the ongoing perturbation. Risk factors are multipara, extremely rare in primary, placental abruption, roomy pelvis, small premature baby. In babies weight more than 2,500 grams, incidence is 3%. Mother not being able to distinguish the sense of fullness produced by the descent child from the feeling of bulky evacuation, associated with increased risk of maternal complication. Cervical and grade 3 perineal tear, need for packed cell transfusion and postpartum hemorrhage, retained placenta. Child may die from suffocation if falls into a lavatory pan containing feces. Drowning if it falls into a pan containing water. Head injury with a fracture of skull or intracranial hemorrhage, bilateral subdural hematoma. Bones involved one or both parietal bone fracture may radiate into frontal and squamous portion of the temporal bone, especially likely to occur if mother was standing. There was a hard floor beneath. A minimum fall of 45 cm can cause a fracture of the skull. The average distance of female genitals from the ground in erect posture is average distance of female genitals from the ground in erect posture is 75 cm. Average length of umbilical cord is 50 cm. Thus, as the newborn is little below or midway between mother's genital and ground, the cord snaps. Cord is torn more commonly at the fetal end than at the maternal end, but is rarely torn at the middle. Hemorrhage from torn end of the cord. Only rarely does it stop due to contraction of umbilical artery. Postmortem finding: placenta is attached to a newborn. Umbilical cord is lacerated, torn. Head and injured scalp shows grass, gravel, mud, sand. Head capital succeeding and molding of head absent. Fracture of skull. Differential diagnosis: fracture produced by forceps delivery. They lie at points normally gripped by instrument, usually of gutter or pond fracture. Intracranial hemorrhages: air passes in the lungs contain blood, meconium, vaginal mucus, mud, gravel, sand, urine, feces depending upon where the child fell or drowned. Material must be compared with the samples or fluid from bucket or lavatory pan. Chemical analysis of fluid in air passages. Example: for soap, disinfectant present in lavatory or bucket. Microscopy of lungs would confirm the presence of chlorine particles. Medico-legal importance is infanticide. Plea of precipitate labor is sometimes raised in cases of infanticide. False allegation. Alternatively, in a true precipitate labor case, a mother may accuse her of infanticide. Case study: J. Harold Ripley of Tottenham report the cause of a 24-year-old married woman who kept getting regular menstrual period throughout her pregnancy, so she never suspected she was pregnant. She attributed her growing abdomen to getting obese and fetal movements to flatulence. On the day of delivery, she went to work as usual but returned. She did not feel very well. At home, there was a slight bleeding from the vagina, but as her next menstruation was due, she did not pay attention to it. She did some housework, cooked dinner, then lay down on the bed half. Suddenly, she found something between her legs and heard an infant cry. She was so surprised that pulled the infant to her bosom, and in doing so, severed the umbilical cord. It was only then realized that what happened, and he called Dr. Ripley. Thank you.